On June 13th of 2013, I had an AVM fistula stroke and had a bunch of grand mal seizures. That was the indication, so they rushed me to the local hospital, and after a couple of days there, they realized they couldn't handle it and sent me to New York Presbyterian. When I was released from New York Presbyterian, I came right to Helen Hayes, inpatient for 7 weeks. The atmosphere in general is very positive. The therapists are all very positive. They're positive with each other. They are positive with you. And, you know, I still remember there was a time when I was working really hard and I was afraid and it was painful, and I started crying, and my physical therapist, Colleen, said, "There's no crying in physical therapy." And so I, you know, wiped the snot from my nose and the tears from my eyes, and, you know, went on with it, because, you know, I thought, okay, I'm gonna trust in her. Some of the tools that I've used in physical therapy are the eStim bike, which is essentially where you hook electronic stimulators to all the major muscles in your leg, and then you sit on a bicycle, and it looks like a stationary bicycle like you'd see in a gym, except that the bicycle's working on its own, and the electronic stim is teaching your leg what it would do if you were using it to cycle on its own. And similarly, there was the RT600 machine, which is a similar concept, only it's more like an elliptical or a stepper walking machine. And again, you put the electronic stim pads on all the major muscle groups, and then it does the walking for you, but it kind of reminds your muscles, this is how you need to fire in order to walk or in order to step. So I thought that was a really neat tool, and I don't know how many other facilities have that. You know, I think that's a relatively new and unique tool that Helen Hayes has to offer. The cognitive issues are where I've come furthest in. So I would say I'm 85–90% recovered in terms of cognitive issues and speech issues, but I'm still not 100%. I'm still not where I was. In my job before my stroke, I was in sales, and I had to stand up in front of sometimes a audience that was against me, you know, not with me, and give presentations, very sophisticated presentations. So I'd stand there for an hour and give very sophisticated presentations and never stutter and never miss a beat and never miss a word and have to use very technical language. And if I ever said, what is that thing called again? You know, I'd be out. You know, they'd be like, oh, she doesn't know what she's doing. So I don't think I'm back to that again. And I feel I was able to benefit from having a team environment as opposed to just, you know, one physical therapist who saw me, you know, in a private room, one-on-one for 1 hour, twice a week, that she brought in other physical therapists at key times, and same with occupational therapy. And my occupational therapist, you know, brought in other therapists to take a look at things, and I was able to benefit from that for sure. My advice, and for what words of encouragement I could give them, I'd say 2 words: be patient. And another 2 words: work hard. So 4 words: work hard and be patient. The recovery from the kind of injuries that people have, from strokes or from, major orthopedic injuries. The recovery is slow. You can measure it, every couple of weeks for a while there. Only people closest to me could see the improvement, because they were looking to see small measurements. So the improvements are so small and incremental, but if you work hard, they will come. You just have to be patient and work hard. And, don't expect improvement overnight. Don't expect that if you wait it out long enough, you're going to suddenly wake up and be able to do things that you weren't able to do the day before. Don't expect that you're going to, go to therapy for 3 weeks and be able to have a miracle happen and, have full functionality of something that you previously had no functionality of. Just accept your situation and take note of the small incremental improvements and be patient, and you will get there.